back on the Zero Hour. I'm your host, Richard RJ Eskow. There are few more universally recognized truisms in this world than the fact that the United States of America's healthcare system, to put it plainly, sucks. And that is, in fact, the topic of my next guest's new book. It's always good to talk with him. Thom Hartmann is the host of the Thom Hartmann program, and is the author of more than 25, probably going on 30 books now, including The Hidden History of Monopolies, How Big Business Destroyed the American Dream, including the hidden history of the Supreme Court and the Betrayal of America. And his new book is entitled, I got to make sure I get this exactly right, The Hidden History of American Healthcare, Why Sickness Bankrupts You and Makes Others Insanely Rich. So first of all, Thom Hartmann, thanks for coming back on the program.
Thanks, RJ. It's great having you being with you, and thank you so much.
It's a role reversal. You're not having me, I'm having you. So, yeah. So first of all, I was going to say your book couldn't be better timed, but I think when it comes to the American healthcare system, it's always a good time to talk about how bad it is, isn't it?
Yeah, and it's pretty bad here. The average American family is spending about $3,000 a year more than the average, or the average American person, about $3,000 a year more than any other developed country in the world. And for that, we're getting, out of the 11 richest countries in the world, we are 11th in terms of health outcomes right across the board. We have infant and maternal mortality rates that are way down in the third world bucket. We don't live as long as people in other countries. We don't live as healthy as people in other countries. And it all can track back to this massive blood-sucking leech that has attached itself to the back of our nation's body. And is just draining large chunks of our money out, and that's the health insurance industry and their multimillionaire and even billionaire CEOs and executives.
And one of the things your book points out is that the structure of our so-called, I hate to even call it a healthcare system because it's not a system; it's more of a demolition derby, but is that we are, in fact, I would put it this way, that we are to the right of a very conservative German political figure of the late 19th and early 20th century, and
Otto von Bismarck.
Otto von Bismarck. So that it seems to me we were remarkably unself-conscious people, Thom, if we don't think about the fact that we're to the right of the guy who worked for the Kaiser with the pointy hat.
Yeah, I mean, Bismarck ran Germany when it was not when it was the German Republic, when it was the German Empire. He was no slouch. He'd have people shot at sunrise just for fun, and he decided that his the best way to have a healthy German populace and a healthy and highly functional German military was a single-payer healthcare system, because it delivered the maximum amount of healthcare at the minimum amount of cost with the minimum amount of bureaucratic red tape. And he put that into place in 1884. The same year that Frederick Hoffman came to the United States. Not the same year, the same decade.
And that sounds like that famous German efficiency we hear so much about. But it is a fascinating, to me, kind of historical artifact, a horrifying one, but a fascinating one. Our system wasn't designed so much as it kind of grew into, it mutated almost, it grew into place. Yeah, including, the fact that when there was a wage and price freeze, if employers could offer more in the way of labor, they could offer, a little bit of medical coverage instead. And, right. I mean, there are a multitude of historical forces that warped, forces. American Medical Association that you cite several times in your book, clearly a major factor in all of this. So what, again, I said it's not a healthcare system, it's it's chaos. chaos full of shooting stars, as a reviewer once described a lecture by Ralph Waldo Emerson, one of my favorite quotes. So it's a chaos full of falling stars, and how how would you describe it? I mean, would you call it fully privatized or pseudo privatized, or just subjected to is it just an oligarchical mess? I mean, I worked in the healthcare field for many years, as you know, healthcare financing, and I've never been able to put my arms around how we got. I mean, I know historically how we got here, but I'm struggling a little bit. But sociologically, what makes us able to tolerate this nutty system? Do you get what I'm driving at?
Yeah, I do. And the answer is one word: racism.
Right.
The word to describe the system is scam. It's a scam that we're living in. It's why we're paying so much more for everything, including drugs. And but what's fascinating is that decade of the 1880s, when when Otto von Bismarck was putting into place single-payer healthcare in Germany. A young man, 17 years old, with $5 in his pocket, emigrated from Germany to the United States. His name was Frederick Ludwig Hoffman. And he slightly anglicized his name by dropping the second N. And he was a genius with numbers. He was a savant. And he ended up getting a gig with the Prudential Life Insurance Company, which was the largest life insurance company in the country, maybe in the world at the time. And he was running numbers for them to figure out, how much should they charge for life insurance for people in different occupations. And he was the guy who discovered that people who work around in cotton mills got lung fibrosis, the people who are exposed to asbestos got mesothelioma, and the people who smoked cigarettes got lung cancer. And those three revelations made him famous, and he co-founded the American Lung Association. The whole Easter Steels thing. That all started with Frederick Hoffman back in the 1880s, 1890s. He then applied his, and he also discovered that people who eat a diet high in processed foods have higher rates of dozens of different kinds of cancer. And in fact, his book on the relationship between diet and cancer is still in print in 2021. And he died in 1946. I mean, he came over here in the 1880s. But in 1890, in the 1890s, he decided to look at the race problem in the United States through a statistical lens. And what he found was, now keep in mind, this was 30 years after the collapse, or 25 years after the collapse of Reconstruction, and 40 years after the end of slavery. What he found was that Black people in the United States in the 1890s were more likely to die of all causes, were more likely to get severely sick from any disease, and had a shorter lifespan than did white people, which is easily explained. I mean, we could easily explain it today. It's called systemic racism, but that was not a thing back then. So he drew two conclusions out of this. He wrote a book called Race, Traits, and Tendencies of the American Negro, which was published in 1896, the same year we got Plessy versus Ferguson and legal apartheid in the United States. It was the foundational work for what for the next 50 years was known as scientific racism. And the conclusion that he drew was, number one, that the reason Black people were dying at higher rates and getting sick at higher rates was because they were genetically inferior. They lacked what he referred to as vitality. They lacked the genetic vitality of white people, that the white race was the supreme pinnacle of evolution, number one. And number two, that therefore, if we simply denied them health care for a couple of generations, they would all die out. And that would solve the race problem in America. So this became actually conventional wisdom across the United States in the 1890s and the 1900s and the 19-teens. In 1912, when Teddy Roosevelt, as part of his Square Deal, when he was running for re-election, he proposed a national single-payer healthcare system modeled on Germany's. In fact, I believe I opened the book with a quote from him about that. And the response he got from people in the Republican Party, he was a Republican at the time, but it was, right across the board. I mean, both parties were insanely racist at that time. Right. But the response he got was, But if you have free healthcare for everyone, black people will get it, and then they won't die out. And so he had to abandon that plan. So in 1936, when Franklin Roosevelt proposed a single-payer healthcare system, it was, but what about the black people? And he dropped that. In 1947, when Harry Truman tried to push a single-payer healthcare system through Congress, the opposition was, what about the black people? And then in 1961, when John Kennedy proposed a single-payer healthcare system, again, it was, what about the black people? And then in 1965, when LBJ was putting together Medicare, he and Robert Ball were writing this program, and they were going to have Medicare pay 100% of everybody's expenses. And the Southern senators came to them and said, but wait a minute. If we don't put a bar that's high enough that most poor black people in the South can't jump over, and keep in mind that 60% of the black population in America today lives in the South. Back then it was closer to 80%. If we don't put a bar in there that's really tough for black people to jump over, they're going to show up at our all-white hospitals, and we don't want that to happen. And that's why there's a 20% gap in Medicare. That's where this whole skin in the game had to do with the color of your skin. The skin in the game phrase that they loved to use back in 65 when they were writing this legislation. And that's why if you're over 65 and you get Medicare, you have to buy a Medigap policy that fills that 20% for your hospitalization expenses. So from 1880, with the world's first single-payer healthcare system in Germany, and discussion about it here in the United States, from the 1880s until the 1980s, the entire opposition to a national single-payer healthcare system in the United States, and even to a comprehensive Medicare system, was based in racism, 100%. From the 80s, though, when Reagan in 1983 stopped enforcing the Sherman Antitrust Act and the Clayton Antitrust Act and the Antitrust Act of 1957, you and I talked about this when we talked about my Monopoly book. When that happened, we went from having hundreds of health insurance companies around the country to having about a dozen major health insurance companies, and each one being, massively profitable. I mean, these are companies that spin off in aggregate $1 billion a week in profit, just leftover money. After they've paid their $1 million salaries to their stockholders, to their CEOs, and their senior executives, and everything, they still have $1 billion left over every week. And so for them to write a $100 million check to do an ad campaign to carpet bomb America, to keep us from negotiating drug prices, or stop that single payer system, or even stop a public option in Obamacare, that's chump change for these guys. And the Supreme Court, of course, enabled it. My book, The Hidden History of the Supreme Court, lays this out. With the Bellotti and Buckley decisions in the 70s, and then they doubled down on it with Citizens United in 2010. And so these companies have the legal ability given to them by the Supreme Court to twist and warp and buy off and corrupt our political systems. And so here we are.
Yeah, and there's so many avenues to pursue from that, Thom Hartmann, but a couple of them. One of the things I really got from your book, The Hidden History of Healthcare, I've been studying this issue for a long time, done public policy work in it, as well as having been on the dark side for a number of years. But one of the things that really educated me was the dimension of racism in the entire system, the role that racism historically played in shaping the so-called system we have today. And in that sense, it's like so many aspects of racism. It, of course, first and foremost, as a moral outrage, of course, harms Black people, but it also, like other dimensions of racism, harms the poorer white people that it manipulates and exploits as well. If you're a lower income, right? If you're a lower income person in this country, white or Black, you're pretty much screwed when it comes to healthcare in this country.
Obamacare provided 90% of the funding for states to pick up Medicaid, which insurance from people who make more. Typically, if you make less than $3,000 a year, you're so poor that you get Medicaid pretty much anywhere in the country. If you make more than around $14,000 a year, you qualify for Obamacare. But there's this hole between $3,000 and $14,000 a year where people just weren't covered. And Obamacare expanded that to the whole country. The Supreme Court said, no, you've got to let the states decide if they want it or not. And so now we've got 12 states that have not expanded Medicaid. And by coincidence, they're all former slave states with significant black populations. 12 states where poor white people are dying for lack of health care because they don't want to give it to poor black people. And these are working people.
Yeah. Yeah, that seems so clear. And Thom, there's another, you write about it in the book, and you just alluded to it now, that I think is so important and understudied and underdiscussed. People think we talk about the healthcare crisis a lot, and we do, but there are some areas we don't explore nearly enough. And one of them is the fact that Medicare, as you alluded to earlier, has some real holes in it. That, I'm a big supporter of Medicare for all, but, the movement has tried to use the phrase expanded and strengthened Medicare for all. That's too many words for a slogan in my view. But the point being, you alluded just now to the copays that people have to pay. In your book, I was really glad that you addressed the issue of so-called Medicare Advantage plans, private plans that suck money out of the Medicare system and make a profit off it and then mistreat their employees. And Diane Archer and I wrote a piece about how those plans aren't even properly audited, and, fatalities and other outcomes aren't tracked. And, they're like an airliner that crashes, but you're not allowed to look at the black box. And I think that's so important that, in a sense, even Medicare, our best public health care program and rightfully popular, is an incomplete work. And I had never thought about racism there as being an aspect of it, which, I would say, well, there's profit taking going on, and clearly there is. And, with the drug benefit, same thing. But it's interesting that profit taking and racism so often go hand in hand in this country in so many things. Isn't this an example of that?
Yeah, one of the largest groups, and there are no statistics available on this, but logic and anecdotal evidence suggests that one of the largest groups that are signing up for Medicare Advantage plans are Black people over 65. Mm-hmm. And they're doing it because on TV, now they've got J.J. Johnson, I think is his name, the guy who played in that, the African-American actor, comedian who played back in the 80s in the sitcom. We didn't have a TV back then, so I'm sorry, I never watched the show, but he's apparently a very famous guy. And not to mention Joe Namath, pitching these things. These are a scam. These are for-profit health insurance programs. They are not Medicare. They are funded by Medicare and it costs more to fund these programs than it does for Medicare to take care of you or me. And we're both on Medicare.
Right.
But and so it's a ripoff of the U.S. government, a big ripoff of the U.S. government. Because it is so profitable, there are Medicare Advantage programs, which are not Medicare again. In 2003, George W. Bush changed the rules so that they can authorize these things and let them call them that. And now about 40% of all the people on Medicare are using these privatized plans. And disproportionately poor people, low-income people, and Black people, because they can offer them with no initial payment. It's a zero.
Right.
In fact, there are even programs that give you $100 a month to sign up with them. But God,
right, and
sick, because you will get such bills if you get sick.
And you'll get such misery trying to navigate the plan, right? To me, yes, of course, the premiums for, the fact that they can avoid charging premiums at all when, even the lowest level of Medicare premium can be a burden for people. And, as you say, sometimes offer a payback or gym memberships or whatever. But they do that, of course. They don't do that out of the goodness of their hearts. They do it because they make money off it. And people find out when the copays start rolling in or when they can't see. I think you in your book, in fact, have an anecdote about, I can't remember whether it was your friend or someone else. It was your friend, I think, who had found out he had a severe form of cancer. First of all, a very instructive story that you tell there. Number one, look, I was a professional health insurance person, and I found signing up for Medicare, as all signing up for all insurance, is enormously complicated and a hassle and confusing, and you can't possibly know which is the right plan and so on. And so someone who isn't that, I mean, I can only imagine. And then he gets this terrible illness, finds out that none of the quality cancer centers in his area were on the plan, right?
That's right. Yeah. Sam was an old friend of mine from the 70s, and I hadn't seen him probably since the late 70s. We used to hang out in New York City down in Greenwich Village together, 5 or 6 of us who got to, in fact, my best friend Jerry is still keep in touch with, every week, still lives there. And so he's the one who told me about Sam. And Sam hit 65 last year, or I guess it was the year before last now. It was back when I was writing the book. And he tried to sign up for Medicare. He couldn't figure it out. And so he thought, I'll put it off for a few months. I'll come back later. And he was still working, a job. He didn't have any benefits, didn't have health care. It was kind of, bottom of the wage scale. And around that time, he was having trouble urinating. It was, he couldn't empty his bladder, and he was getting up 5 times every night. And so he went to a doc in the box, one of these urgent care centers that was run by a big hospital chain. And they pulled blood and did a PSA test and said, your PSA is so high that you almost definitely not only have prostate cancer, but it's probably left your prostate and is in the rest of your body. And therefore, you need to see a specialist immediately. And but I don't have any insurance. And they're like, well, our hospital group has a Medicare Advantage program that we offer. We no doubt they get a commission,
right?
And from XYZ company. And so he signs up for his Medicare Advantage plan, thinking that he now has Medicare. And he calls Sloan Kettering, which is the top male prostate cancer center in the world, and certainly the best in New York City, and says, I have Medicare and I want to come in. I want to see a doctor. I've got a PSA of 300 and something or whatever it was. And they said, okay, cool, come on in. And he comes in, a few weeks later when they finally have an opening for him. And as he's signing in, they're like, oh, let me see your Medicare card. And he's like, well, I have Medicare Advantage. And he gives them that. And they say, well, we're out of network for this company. So if you want to see this doctor, it's going to cost you a couple $1,000s. And if he does surgery on you, it's going to cost, tens of thousands of dollars. And so you really should go someplace else, because he didn't have that kind of money. And so he then goes back and tries to sign up for regular Medicare, which would cover at least 80% of his costs, and get a Medigap policy. And he discovers that if you get a regular Medicare and a Medigap policy when you turn 65, they may not look at your pre-existing conditions. It's against the law. But if you've had Medicare Advantage and then you're trying to come back to Medicare and get a Medigap plan, all bets are off. And the Medigap plans, which are highly regulated, can turn you down for a pre-existing condition. And so, his plan now is to, and I've got to ask Jerry where he's at. I haven't talked to Sam in quite a while. But his plan, the last I heard, his plan was to have Medicare pay the 80%. And then when all the bills come in for the remaining 20% to declare bankruptcy.
Yeah. It's horrifying that our system, first of all, makes people do that. And secondly, we don't really consider enough the enormous strain and unpaid labor and everything else that goes into the kind of paperwork that goes with our system. Is just appalling. It's just horrifying. And
there's a hospital in New York, and I don't recall if this example is in the book or not, but there is a hospital in New York, and there's a very, very similar hospital in Toronto, Canada. Same number of beds, as I recall, in the 530 range beds, more or less. The hospital in New York has a floor and a half devoted to billing with probably 100 employees. All they do is just fight with insurance companies all day long and Medicare and everybody else. The hospital in Toronto has one office with 2 desks with 3 people for the whole hospital.
When I was the head of medical management for Liberty Mutual, which was mostly workers' compensation, how many bill review nurses do you think I had working for me? Just guess.
10?
1,000.
1,000?
Yep, reviewing medical bills and pre-certifying surgeries and all that stuff. And this was mostly for workers' comp. So,
Which, by the way, would
yeah,
go away if we had Medicare for all. I mean,
right.
that's another thing, and I don't think I made this point very well in the book. I think I just kind of mentioned it in passing. But if we had Medicare for all, there would be no need for workers' compensation. There would be no need for a health insurance rider on your car policy. There would be no need for a health liability part of your homeowner's policy. I mean, there are literally dozens of places in our lives where there's little tiny wedges of health insurance that are sold to us in addition to the regular health insurance we get. Because, like, if you're injured on the job, your regular health insurance may just, exclude that, and say, no, that's workman's comp. And then you're with a completely different insurance company and a whole new set of rules. It's crazy.
And because in the workers' comp system, you often don't have a choice of doctor you can see either. And there's this mutual waiver of liability. So you can't sue your employer in many cases. And, I remember being horrified. This was many years ago, but, loss of an arm and state X would get you $1,200, and just these $800. I'm not giving you my arm for any less than $2,000 minimum.
These numbers that were put into law back in 1912 or something.
Yeah, it's just horrifying. But Thom Hartmann, before I let you go, and we got a few minutes left, I do want to talk about, I would say your book makes, among other things, although it's the hidden history of healthcare, it makes what to me, and of course I've come in with a bias, but it makes to me a compelling case for Medicare for all, or something like it. It's whatever the name. We've been talking about this in this country for nearly a century and a half. We've had presidents from Teddy Roosevelt on bring it up, Franklin Roosevelt, Lyndon Johnson. You mentioned Robert Ball when they put Medicare together, just assuming it would eventually be expanded into covering everyone. How do we get there from here? And I know that's a big question. It's not entirely fair, but it's been on my mind a lot. Obviously Bernie Sanders lost the 2020 primary, but surveys showed that majorities of Democratic primary voters in every single primary state supported Medicare for all, or single payer. And it's growing in popularity in the United States. And yet the conventional wisdom here in DC now seems to be, well, we didn't get that, I guess we move on. But it's desperately needed in my view. So assuming you agree with that, any thoughts on how we get there?
I think we're probably going to get there the same way Canada did. In Canada, you had one province, Saskatchewan. Tommy Douglas was the premier, and he pushed through Medicare for all, and it worked so well. In fact, they call their system Medicare. It worked so well in Saskatchewan that Alberta and British Columbia wanted it, and pretty soon, it just spread across Canada, right, over the next decade, until finally every province had it, and the federal government stepped in and said, okay, we'll provide a backstop for this, and also kind of some back office accounting. So if somebody from Saskatchewan gets sick in Ontario, we'll handle, moving the money back and forth between the two state systems. So every state runs their own system, and there are differences. Some cover eyeglasses, some don't. For example,
right.
Different amounts. They're all roughly about $100 a month. For the average middle class family. If you're poor, it's nothing. If you're really rich, it might be $150 a month. So Vermont has passed this. Peter Shumlin ran for governor on this plan. Right. He got it passed through the House and Senate. He signed it into law as governor. He's no longer the governor there, but he did. And then when a friend of mine, in fact, was the head of their health at HEW, or whatever they call it in Vermont, who was supposed to put it into place. And what he discovered was, Vermont being the first state to do this, what they discovered was that back in '65, when they were putting together Medicare, they wanted to make sure that the southern states didn't take their Medicare money and then refuse to spend it on black people. So there's kind of an audit trail from the federal all the way down to the consumer. If you put your money into, and there's billions coming in every month into Vermont for all their Medicare patients, and also all the Medicaid, the low income people. Right. And both of those funding sources would have gone to zero. And so what needs to be passed, and Democrats have been trying to pass this through Congress forever. It's passed the House a couple times. It's always been filibustered in the Senate. But what needs to be passed is a piece of legislation that waives these Medicare and Medicaid. It's called Medicare Medicaid waivers for the states that allow individual states to continue to receive that money, but without the necessary audit trail, without all the paperwork associated with it, so that they can put single payer systems into place in their states. California has now done this too. And again, they can't put it into place because they don't have these waivers. So that's what we've got to do.
It's ironic, isn't it, that our government is very happy to divert Medicare dollars into for-profit corporations, but is not willing to divert Medicare and Medicaid too. It does it with Medicaid too, but is not willing to divert those dollars into states that are trying to represent the will of their voters and look out for the interests of their people, but by providing health care to everyone. Then all of a sudden it's no, we can't do that. That's against the rules or whatever. Don't you find that?
We need to get the waivers passed. I mean, that's your message for calling your two senators and your member of the House is Medicare and Medicaid waivers so that the states can do single payer.
Yeah, the one thing I worry about there, Thom, is just economies of scale. We have Medicare up and running nationally. I do worry. I mean, it was one of the things with my old actuarial hat on, is one thing I with loving concern, I watched as Vermont went through it. California is certainly big enough. New York's big enough. But states that are porous like that, where you can move in and out, I worry a little bit. But
there's some talk about doing it on a regional basis, like New Hampshire and Vermont could get together, or New Hampshire, Vermont, and Massachusetts, or New Hampshire, Vermont, and Maine, and you could have regional collectives. But this is something that Bernie proposed on my program well over a decade ago. He said that he thought that the best way to get Medicare for all wasn't through a single federal program, but was to do it through the states. On Jefferson's theory that the states are the laboratories of democracy, and that you'd have a bunch of different competing plans and ways to do it, and let the best plan win. And I think that's how we're going to get it, frankly.
Well, I just hope we get it. That's the win. And also, to the point of your book, I certainly hope we get these profit seekers out of the Medicare system as it currently exists too, because that is, in my view, like rust. It's just corroding the entire system. Before I let you go, Thom, anything else about the book you'd want listeners and viewers to know?
I think I've made the major points. I mean, I opened the book with the story of how Taiwan spent the entire 2020. They got their first case of COVID the day after we got ours, January 20th, 2020. And at the end of that year, we had 500,000 dead Americans, and they had like a dozen dead Taiwanese, maybe. Basically, they stopped it dead in its tracks, and they used their single-payer healthcare system to do it because everybody was in one single national database. They were able to instantly do contact tracing, and testing in ways that really, really worked. And as of a week ago, last time I checked, now Delta came in and has been kicking their butts, as it is everybody all around the world. This nation of 23 million people has had 16,000 cases and 837 deaths. Compare that 837 deaths in Taiwan, yes, they're 8% the size of America, but you're not seeing 12 times more than 800 cases in the United States. You're seeing massively larger. Now, we have now had more Americans die from COVID than died in the Spanish flu epidemic.
Yeah, and more than have died in any of our wars to date.
Combined.
What's that?
All of our wars combined.
Yes, that's what I meant. Yeah, I said any, I meant all. So thank you for that correction. And also thank you for writing.
I may be wrong on that, RJ. It's just occurred to me. The Civil War was 600,000 and World War II was around 600,000 too, I think. So anyhow, yeah.
Well, we'll have to research that and put it on our respective Twitter feeds or whatever. I thought it was all U.S. deaths to date, but you're right. Although I do also think we undercount COVID deaths. There was one study from a couple months ago suggesting the death toll might be close to 1 million, even then. So, and that there are undercounts, misreporting. But in any case, it's far too many. In any case, one good perspective on it can be found from this excellent new book by my guest, Thom Hartmann. The book is The Hidden History of American Healthcare, Why Sickness Bankrupts You and Makes Others Insanely Rich. It also, unfortunately, sometimes kills you, too. So we're trying to prevent that as well. Thom Hartmann, a host of the Thom Hartmann program and author. As always, it's a pleasure talking with you. And as always, thanks for coming on the program.
RJ, as always, it's an honor and a pleasure to hang out with you. Thank you for the invitation.
And we'll be right back after this. I'm Richard RJ Eskow, and this is The Zero Hour.